Well, good afternoon and a warm welcome to all. Welcome to Amazon Internet Services Presents the Economic Times Global Digital League 2.0, co-powered by Kyndryl. Indeed, it's the second edition of the Global Digital League, and our theme for this edition is Gearing for Unmatched Performance. I'm your host, Deepthi Harwani, and I welcome you to the healthcare track. Before we kickstart the proceedings, let me extend a heartfelt thank you to our partners. Presenting partner, Amazon Internet Services. Co-powered by partner, Kyndryl. Innovation partner, Dell Technologies. Platinum partners, NetApp and Reddington. Our gold partners, Commvault, Juniper Networks, Exclusive Networks, Fiserv, Checkpoint Software Technologies Limited. Our associate partners, Datamatics, Jabra, and Poly. We also thank our supporting association, Commodity Participants Association of India, the Cyber Society of India, and National Accreditation Board for Hospitals. Well, thank you so much once again. Ladies and gentlemen, let's talk about the current healthcare scenario in the country. In India, the doctor-patient ratio and the nurse-to-patient ratio is extremely poor, due to which work with limited resources has become extremely stimulating. The healthcare and pharmaceutical businesses, along with the government, are taking immediate and necessary measures, including a growing infusion of technology across subsectors to ensure the well-being of over 1 billion people. Fueling the idea of digital health is the dawn of the frontier technologies era. Artificial intelligence is a new revolution that is expected to change the face of the healthcare industry. AI would power analysis of data set related in patients. This would further enable to deliver high quality healthcare facility in lesser time at a lower cost. Today, the healthcare industry has already started using robots to improve the current standard of care, while also helping humans to do things that they would have not been able to do in the past. Robots such as surgical robots, exoskeletons, care robots, and hospital robots have all proven to be extremely beneficial across the globe. This new development in the healthcare universe has helped in improving the accuracy, precise diagnosis, remote treatment, and augmenting human abilities. In the forthcoming sessions, we shall understand how healthcare and pharma companies are shaping the future of their industries, keeping in line with the vision of faster, safer, and affordable healthcare services. So stay glued as we bring to you a great mix of enriching sessions full of insights and information. Well, in addition, let me tell you as to how you can make the best use of this platform. From the main lobby, you can visit the Networking Lounge and indulge in the very many networking opportunities, where we have many features like business card exchange. You can also connect with like-minded people here and have an exchange of ideas. The auditorium is where you can choose the tracks that you want to attend. Currently, we have 5 parallel tracks running simultaneously: Healthcare Digital League, GCC Digital League, Manufacturing, Unicorns of India, and BFSI. The Agenda tab. Now, this is where you shall find the agenda for the event for your reference. So all the sessions will be listed here. Our Speaker Lounge. This is where you can take a quick look at all our speakers for the conference. Click on the Experience Zone where you can visit the partner booths and learn more about our partners. You can download their brochures, connect with the booth representatives, and book appointments. Information Desk. This is for your assistance, which primarily has live chat and technical help. Now, very important is the leaderboard, where we have many exciting vouchers for you to be won. With each activity, you score a set number of points, and once you have earned 2,500 points, then you are eligible to win so many gift vouchers. Don't forget to download your digital certificates of participation. The feedback form button. Of course, you click on it to fill up the feedback form and earn a lot of extra points. Of course, you can post your views, comments, feedback on Take a Break. So click on the Take a Break button and you can post all these on the signature wall. And lastly, do share your comments, views, and tweets on social media using the hashtag ETGDL. We are waiting to hear from you. it's now time for the keynote address on making lives better, NextGen Innovation hitting the right chord in healthcare. From pharma to patient care, technology will play a key role in the next decade. This session will outline how different stakeholders can facilitate better healthcare centered around technology and ensure that these facilities reach everyone everywhere. And to render the opening keynote, I'm delighted to welcome Brandon Rowberry, CEO, Digital Health, Aster DM Healthcare. So thank you for joining us, Brandon, and I welcome you to the virtual dais.
Next generation's innovations in healthcare are literally swirling all around us. There are so many that it's hard for those of us in the field of healthcare to even come close to keeping up, much less many of you who probably aren't part of the field in this exciting and important industry. So I thought I'd take some time today to give you just a flavor for what's coming and how we might play the right innovation chord going forward. But since we're talking about innovation chords in healthcare, let's go ahead and use that, right? Let's use the metaphor of a piano, a standard piano, which has 88 keys on it. How do I know, you ask? Probably because, like many of you, my mom made me practice that thing nearly every day. Now, I wish I would have actually paid more attention to my mom back then. I'd be a better piano player right now. But I know it has 88 keys because I used to plunk out each one of those up and down the scale when I was a little kid. Young children, you can often see them banging down on the keys. I know you've seen this. I used to be one of those little kids, banging down on as many keys as I could. But then over time, I learned that in order to make beautiful music, I actually had to play different keys at different times. And sometimes I'd learn, then I could play a few different keys and they would make what? A beautiful chord. I couldn't just bang on all the keys anymore. I think likewise in healthcare, if I can use that as a metaphor, we have innovation keys. We have innovation notes that are coming at us all the time. And by the way, it's way, way more than 88 keys on a piano. And if we just try to play all of those innovation keys all at once, just like a little child, I don't think it's going to sound the best. So may I suggest that in order to hit the right chord in healthcare, we need to simplify and we need to understand just like we do on a piano. So what I thought I'd do today is just give you a non-exhaustive little list of just a fraction of the innovations in healthcare, because I know many of you are going to know a lot of these, and perhaps we'll get into a few that you don't, to just look at what's coming and then talk about perhaps the right way to make some beautiful music with an innovation chord in healthcare rather than just bang on every one of these keys, all right? So let's get started. Let's take artificial intelligence, right? Everybody's talking about this through almost every industry I can think of. But in healthcare, we have smart algorithms, natural language processing, computer vision, processing millions and millions of study points like that. What that brings to the healthcare table is incredible and will transform healthcare as we know it today and in the future. You've got that artificial intelligence doing the diagnosing, sometimes even better than the human doctor themselves. You have AI digesting now every scientific paper ever written and bringing that content to the forefront. Imagine how that can improve the health of your loved ones. Let's move on to 3D printing, right? 3D printing of drugs, 3D printing of casts if you break your arm, 3D printing of organs, tissue engineering. Imagine tissues that we can actually engineer, that we can build, that make life so much better for so many people. What about things like portable diagnostic devices, the size of a credit card, sometimes even smaller, up to and including the phone in your pocket right now, a fraction of the size of what you can find in a clinic or in a hospital, an even smaller fraction of the cost of those medical devices and how that can bring to the forefront. What about really small things like, say, digital tattoos? Have you seen these? Go on your arm, some part of your body, like electronic skin, measuring your medical vitals inside care settings and outside of what we would traditionally call care settings, but they can actually go there. What about DNA sequencing? If we were here in live, I'd have you raise your hands and tell me how many of you got your DNA sequenced. Well, now with direct to consumer genetic testing and genetic sequencing, you can do that. Genomics, personalized medicine, specific gene therapy that's not just for the masses anymore. Now specific gene therapy for you personally, for me personally, based on my specific genetic code. And then take it one step further if you really want to get healthy, right? Nutrigenomics. After having your DNA sequenced, you can use smart apps of nutrigenomics that can hyper-personalize your nutrition. And grab one more app and you can get that nutrition delivered right to you. Smaller things, at least we think of them as smaller things. What about chatbots? First line of care, first line of helpers in advice, in delivery to help you understand your symptoms. What about augmented and mixed or virtual reality, whatever we're calling it nowadays, that enables clinicians, doctors to see inside the patient and plan sophisticated surgeries, more precisely giving care, allowing for better healing. It's just phenomenal. Then we get into robotics. You've all seen these robots that get in, make little tiny incisions, can do things that human hands cannot do. Not just surgery though. What about robotics and exoskeletons and other non-care settings that can help people live healthier lives? What about something a little bit easier, like just virtual doctor or nurse consultations, like almost what we'd be having right here? I know many of you have already done this. How's that experience? Making that even better. What about health sensors that then you can use with that doctor or nurse? What if you pair up the health sensors, the portable diagnostics, and now the virtual doctor consultations to make that a more holistic and even better care setting? Then we get into things like cloud technology, making important information accessible and actionable like never before. So let's take something a little more difficult that really blows my mind. What about brain-computer interfaces? Have you seen this? Where we literally are tapping into the brain to allow movement of limbs and other things that don't have movement today. Absolutely incredible. Nanotechnology, operating inside your body with precision delivery mechanisms to the cellular level. Just incredible. What about being able to operate intensive care units virtually, allowing great access to top clinicians from around the world where there might be a shortage in certain locations? What about inpatient, meaning in the hospital setting, virtual doctor consultations in specialized equipped rooms, allowing doctors from around the world to converge on special cases? Take things that aren't necessarily medical, but then have a healthcare bent to them. Let's take drone delivery, right? That's kind of a fun one. If you have a drone, it can come in, it can deliver life-saving medicines, diagnostic equipment, and other things in places where we have trouble getting to. Stem cell cures, global genetic biobanks, whole new ways of researching cancer. I mean, this list just keeps going on and on. Ultrasounds that are literally can be in your pocket. What about digital therapies? You no longer have to ingest or intravenously put something inside your skin to have therapies, but there are effective ways to treat patients that have nothing to do with these now, that can be done with fully digital means. Those are coming in the forefront. What instead of 3D printing, what about 3D digital? Have you seen this? 3D digital hearts, lungs, kidneys, essentially twins of your body that can allow for better care of you personally. What about the trend of ongoing consumerization of healthcare, meaning more access to what we need and what we want? What about all these wearable devices on our wrists and other places, empowering us with information to drive our own more healthy behaviors if we use them in that way? Blockchain as a healthcare technology, allowing for further transparency. The Internet of Medical Things, which is basically this huge connected infrastructure of medical devices and software applications, bringing them all together, allowing for huge leaps in potential care. What about the opportunity now to have hyper-engaged patients and hyper-enhance that patient engagement like we've never had before? What about basic e-pharmacies, home health delivery availability, care wherever you are instead of in the sort of quote unquote traditional doctor or care setting? Centralized and specialized monitoring of hospital and in-home patients. What about 5G broadband enabling that hyperconnectivity to come across? It's just phenomenal. Smart hospitals, smart clinics, smart homes, along with patient engagement, might be some of the biggest trends in healthcare. Let me pause. I'm really just scratching the surface. There are so many, many more innovations and keynotes to play, and we could go on for a long time. But for this conference, we should think about how do we bring them together. May I suggest that we might bring the discussion up a level from just the amazing innovations to the needs of people and how we can deliver on those needs in healthcare. Let me outline just 4 needs. There are more, but there are 4 that create a beautiful chord of innovation in healthcare, at least for me, that I would suggest you might want to look into as well. Number 1, the first note to play is access to healthcare, access to healthcare services. It is a tragedy in our modern world that we still have billions of people without access to basic healthcare and basic healthcare services. Those innovations that can enable greater access to needed care are absolutely top on my list of keys on the innovation healthcare chord. Number 2, affordability of healthcare services. Do you know that healthcare is now, for many, many developed countries, the number 1 line item on the budget? Meaning governments spend more on healthcare than they do on anything else in a number of countries. It is quickly and tragically bankrupting families, companies, and even whole countries. You know, I remember just a few years ago, I think it was, when major auto manufacturers crossed that line in their budget to what now they spend the most money on. It went from spending the most budget on steel or rubber or other equipment that goes into manufacturing the car to now spending more on healthcare for their employees than any other line item. What innovations are coming at the forefront to make basic healthcare services more affordable to all? Because let's face it, if it's not affordable, then is it really accessible? I would beg to differ. Number 3, third key in my chord of innovations in healthcare, the ability for people to care for themselves. Now, I know what you're saying, Brandon, you work for a large healthcare provider. You don't want people to necessarily care for themselves because it will impact your business. And I would tell you, you couldn't be more wrong than that. As much as I work for a very, very large healthcare provider, we love to care for our patients in all geographies, no doubt. But we also promote and put huge effort into helping people care for themselves as much as possible. I get excited about what we call the consumerization of health, meaning the ability for those of us to care for ourselves by making things accessible and cheap so that we can make it happen, enabling all of us to make the smart choices with smart technologies that we can easily employ. The new innovations coming that enable people to better keep themselves well, both physically and mentally, are the third key in my chord to innovations in healthcare. The fourth key is broadening the boundaries of what can be cared for. The ability to save and enhance lives is at the very core of healthcare and is at the very core of our mission as healthcare providers. Innovations that help enable to make lives better by enhancing people's ability to live healthier lives is absolutely a key in the chord. Look, there's room for many in this innovative digital health new world that we're going forward with. We need solutions. We're not going to be able to come up with all of them, and we welcome those who are bringing them forward. But please, as you do it, consider, don't just bang all the keys at once. Don't just bring all the innovation flood at once. Know what you want to play and hit the right innovation key to make beautiful healthcare music in the future. Thanks. It's good to be with you.
Well, thank you, Brandon, for that wonderful keynote. I would like to remind our audience again to please visit the partner booths at the Experience Zone to get a chance to win exciting gift vouchers. That's right. Please do visit and join the NetApp booth at the exhibition space and fill the feedback form, because 10 lucky winners will stand an opportunity to win Amazon vouchers worth 1,000 rupees each. Please do also visit the Kindle booth And do not forget to fill the feedback form to earn some extra leaderboard points. Meanwhile, join us for our next session, a power packed panel discussion coming up shortly.